Okay, welcome everyone. Thank you for joining for today's session. This webinar is part of our Capital Conversation series, and we are bringing together leading experts and advocates and partners to explore timely policy issues and their impact on the work that we do. Today's session, Here We Stand for Medicaid. It is our new messaging and resources where we'll focus on the current Medicaid landscape and how we can more effectively engage policymakers and the media and other key stakeholders to defend and strengthen Medicaid. We'll share new messaging tools, resources designed to support your advocacy at the state and federal levels. We are so pleased to be joined by a terrific group of speakers, including Kat Maramba, who's a senior communications strategist, Karen Seaver Hill, who's the founder of Yes and Strategies, and Jonathan Schrag, who's the Vice President of Public Policy and Advocacy at the Network of Jewish Human Service Agencies. But we're also pleased to welcome two of our Lutheran Services in America members, Aurora Kerpa, who's the President and CEO of Kencrest, and Aaron Sutton, who's the Senior Director of Public Policy for Lutheran Social Services of Minnesota. We are so grateful to all of our speakers in bringing their expertise and perspective to today's conversation. But before we get started, we want to have an interactive session, so please feel free to enter your questions in the chat box at any point. And before we formally begin, we'd like to ask you a complete one-question poll to help us gauge everyone's level of knowledge. We actually have two questions, but the first one is, how would you rate your current confidence in using messaging tools to advocate for Medicaid? They could be your own internal tools or the ones that we've provided in the past, but we just want to get a sense of your level of comfort. Well, great. The first, as the scores are coming in here, we have 8 or more of you that have a good level of confidence and a high level, and then we have some that are limited and basic. And our goal is to bridge that gap to bring you guys all up to the higher level of confidence because these tools are great, and we think you'll really be able to use it in your advocacy efforts. And the second one is your organization currently involved in state level advocacy, and we have as part of a state association or independently. And right now, again, about 9 out of the 10 people participating are seeing that they are using both of those, both the state and also as part of an independent organization. So thank you. I want to give a quick update on our current advocacy work that we're doing at the federal level. So I'm going to have Kylie share just a high level view here. So Karen, our first speaker, is going to go in further depth in this, but we did just want to bring your attention to two things that we're following. Last week, there was a Reconciliation 2.0 bill that was passed, and it was largely focused on the budget resolution of ICE and border control. And so while it excluded at this time Medicaid and healthcare cuts, we do anticipate that part of that was that the leaders have promised there would be a third reconciliation bill that would include some of those findings under Medicaid. So it could have a future risk for Medicaid cuts. And so those details will determine as we go forward. Last week also, Senator Ernst from Iowa released a Protecting American Taxpayer agenda, which emphasizes stopping government waste and fraud and abuse and oversight through audits, increased transparency, and also accountability for the taxpayer dollars that are being used. So we're tracking both of those to see what the energy around Congress this summer and this spring where they're at. Last I want to end is just my last comment is that last week on April 23rd, we had our LSA fly-in meeting. We had over 40 meetings on Thursday, April 23rd. Many of our members were in town, both board members, members of our policy and advocacy committee, and members of the Disability Network. So we were very pleased with that effort and really tried to have a lot of key conversations in that effort. So it is my pleasure to introduce Karen Seaver Hill. She is going to present for us on a lot of the work under our messaging and kind of set the table as we move from her to our second presenter, who's going to talk a little more about the tools that we're using, but she's setting the stage of where things are currently at. Thank you, Karen, for joining us.
Thanks so much, Bill. Thumbs up if you can hear me okay. Thank you, thumbs. I appreciate that. I'm going to share my screen and share it in a more attractive way. Thumbs up if you can see my screen. Okay, great. Thanks so much. I'm really, really happy to be here with all of you. These slides will be a part of your follow-up material. So you can just listen, you can chat in the chat if you'd like, and we have some discussion after my colleague Kat adds to this conversation with even more actionable things for you all. You care deeply about Medicaid. It covers about 1 in 5 Americans. In order to be an effective partner to Medicaid right now, we believe that you could benefit from some context, a little bit of a compass, so that you are really well placed in your advocacy and your support for the Medicaid program. So we're going to focus a little bit on what's happening in your state as far as a financial position, and then why is program integrity being spoken about everywhere. So here we go. If you don't already know it, your states are not in a terrific financial positioning right now. There were some benefits y'all took advantage of in the post-pandemic era where there were extra federal relief funds flowing into your state in the form of enhanced federal match for your Medicaid dollars, as well as ARPA stimulus dollars, all of which are gone. Our friends at Pew have done some research and indicate for the first time since the Great Recession, your state rainy day funds have declined. This is not a great thing since this is a strong economic indicator of resilience for your states. And then lastly, there is year over year growth to the Medicaid program. It has been happening for a very long time. Some pundits thought that at the end of the unwinding, where we reset after the public health emergency, we would net to a lower number of insured persons in Medicaid. That did not happen. So Medicaid still dominates your state's funding, up to 30% for some of you. Within that state fiscal climate comes the impact of the One Big Beautiful Bill Act, otherwise known as HR 1. You all have heard a lot about this from Bill and team. But the thing to know is that there are three financial impacts of the act that are putting pressure on your state. There are some enrollment provision changes that you need to be aware of as dictated or detailed here on the slide. There are some financing provision changes specifically around state directed payments that lead to budgetary loss as shown here on this slide. And there are also some eligibility changes. They have a smaller impact of about $10 billion each, but when taken together, these are significant costs and impacts for states. There are a couple bright areas in HR 1 where we see funding increases in the name of the Rural Health Transformation Program and some HCBS home and community-based services waivers. Critically, we'll look in a slide or two, do these increases offset some of these decreases that I just mentioned? Spoiler alert, for most of us, no. The folks at RAND have put together an incredible resource for you all if you want to get deeper into the state level impacts of these key provisions of HR 1. If you remember one thing from this talk, do just hold in your head that RAND is estimating of all the provisions in HR 1, there will be 7.6 million fewer Medicaid enrollees by the year 2034. It is interesting if you look at the federal savings is projected to be about $714 billion, which is very, very close to the reduction in what state Medicaid budgets will be hit with too. So there is a little bit of passing the ball there. It is important to understand what, according to the RAND research, are the drivers for this expected decline in enrollment. Number one, far and above are these new work requirements. We'll hear from Jonathan a little bit later about how these work requirements are playing out, but that's the biggest driver for reduced coverage of persons by Medicaid. followed by the provider taxes that I mentioned in the previous slide, and some of the changes in redetermination, what we nickname churn. It is either by default or design, just depending on how cynical you feel on any given day, but churn amounts for a lot of the decline in enrollment as folks covered by Medicaid struggle to keep current with their application. The thing to remember is the impact on the Medicaid budgets will not be uniform. There will be substantial state to state variation relative to these provisions. Again, this is RAND's very, very fine work. There are a few states, Arizona, Iowa, Nevada, among them, who will see the largest Medicaid budget reductions. These are expansion states. These are also states that rely fairly heavily on state-directed payments. So there are two areas where HR1 really has come to roost in these states that you see with these large budget reductions. There are some states that will feel little or no impact. Largely, these are non-expansion states. And some of these might even see a net win. Wyoming and the Dakotas being among them, South Dakota and Wyoming, with their very small populations and the fact that they are not reliant on these Medicaid financing provisions. These states will fare rather well with the new investment in the rural health dollars. So the key to remember is there is a real substantial difference from state to state. You would probably say, hey, Karen, there are also some locally funded things, such as perhaps your DD. You might say to me, we've got property tax issues in my state or county. All of these combine to impact the financial straits in your community to cover people by Medicaid. So here you see a really elegant chart, again, created by our friends at RAND, that will show the enrollment impact by state. On the far left, there are about 10 states who will have as high as 20%, 15% and up change in enrollment in those declines. At the far right, you see some of the states that are very mildly, if not at all, impacted. Again, these experience very little change. The work requirements will not impact them very much as a non-expansion state. So this is a very helpful tool when you think about who is it that you're talking to about the importance of Medicaid and what is already on their mind and their plate. We have created two resources that you will get after this call, if not during the chat. I really hope that you take some time to look at them. We go through these financial constraints a little bit more, and we talk a little bit about program integrity. Why is program integrity on everybody's lips? Well, when you're in financial constrained position, then you're looking for places to save money and cut costs. We already see that demonstrated in Congress. Bill had already alluded to a new piece of legislation advanced by Senator Ernst of Iowa just last week, a 17-part bill package, again, really aimed at anti-fraud and savings, as well as some modernization investments. So we know that there's a very big appetite in Congress to take a look at anti-fraud. In this paper, again, that I hope you'll receive and look through, we'll encourage you to try and normalize that program integrity is a very long established and shared function of the federal and state governments. It is nothing new. You may be hearing about it a lot more because, again, the physical situation is tight. The appetite is high with this Congress administration to crack down on abuse. But this is a very, very normal and established function of your state and federal partnership that makes up Medicaid. In this document, we would also spend a little time, and I hope you do too, differentiating between waste versus fraud and abuse. Some of those actions are criminal and some are not. We are all focused, your states are focused, and those who support the Medicaid program on making sure that it is efficient, effective, and impactful for the people that are covered by the program. So there are a lot of things your states already are doing to try and make the program function that way. An important level setting, thanks to some recent work by MacPac, is that the full scope of waste, fraud, and abuse is not known. They project that in fiscal year year 2024, waste, fraud, and abuse accounted for less than 1% of Medicaid spending. So while the appetite and the feeling is high, the reality is really pretty low when you think of a proportion of that spend. And I would really encourage you to take a look. There was a recent RFI. It had a very tight turnaround. If you didn't have time to read on it later, I do recommend that you look at the comments from the National Association of Medicaid Directors. They are a bipartisan group of your state Medicaid directors. They work very collegially. They put together some terrific comments. It would serve you well to know where your Medicaid director believes they could be making improvements in such areas as modernization and improving the federal-state partnership so they truly do get after criminal acts and they make the program function more effectively. I hope you'll take a look at that and then the other materials in this new resource for you. The second resource that I want to call your attention to is a very brief action guide. It helps you understand a little bit more, in addition to where the Medicaid program services are under scrutiny, just what are the things you need to know to take action. I believe this group has already talked a little bit about the fact that while work requirements are really important, Jonathan will speak to this in just a few moments, states really lack a reliable and successful pilot. We know a couple states had been out front for work requirements, but in a group that really likes to share best practices, they don't have one to hang their hat on. So think about that as you come to the table with solutions and a reliable partner for how things look on the ground with this population. It's important as you take action as advocates to know the turnover in Medicaid leadership is higher than I've ever seen it. I cite some of the reasons why here on this slide. And as Bill already said, keep your head on a swivel. We need to prepare for where there might be other cuts and other enthusiasm for fraud. Thankfully, there were not cuts to offset the Reconciliation 2.0 that was just passed. But we do anticipate the administration has foreshadowed where their budget will continue to look at non-defense discretionary cuts in the future. When you look at this action guide with these things in mind, we're going to encourage you to try and work to build relationships with the committees of jurisdiction and the state leaders in your Medicaid program. You can do that in sit-down visits. You can invite them into your agency. You can do that individually or act in coalition. And thanks to the materials that were developed by Kat, who will share it next, we have a lot of talking points if you elect to do things such as writing letters to the editor or using tools such as op-eds. These tools will be yours as you move forward to continue to champion the Medicaid program.
Wow, thank you, Karen. That's a lot of information, and I gave you kind of a short ramp to provide it all. So thank you. We're going to have a chance to ask Karen questions after Kat's presentation, but I just really appreciate you continuing to put ourselves in a position where you show our trustworthiness and our integrity of how we provide service, but reminding ourselves that these tools that you're presenting for us are they're to help us prepare the questions that we might have while we're interacting with legislators. And the tools that Karen's going to present really complement that. It's kind of the research base connected to the truth behind some of those conversations that are out there. So thank you very much. And next we'll turn to Kat. And Kat's going to give us the tools to make us successful in these conversations. And thank you for joining us, Kat. And just one other comment is that there are links for all of the documents that we just had that are for you to grab from here, but we'll also send it out by email, and it's also going to be on our website. So thank you, Kat, and appreciate your time.
Okay. Hey, everyone. I just want to do a quick check that folks can see my screen. Awesome.
Yes.
Thank you. Well, I'll go ahead and start briefly about what has changed about the messaging, and then go ahead and move into the tools that we've developed to support you. At a high level, we've sharpened the message to better reflect what you're seeing on the ground and what we've heard directly from many of you. You'll see a stronger through line around workforce, as well as a new Here We Stand principles and action section that really brings our key messages to the forefront. There are 3 key shifts that I'll quickly highlight in the messaging. First, it is more grounded in state budget realities. and the impact of HR 1 on Medicaid programs. We're really helping connect the dots here between policy changes and what they mean for access to care at the state level. Second, we're focusing on addressing fraud, waste, and abuse more directly, while also reinforcing the safeguards already in place. And importantly, spotlighting the generational trust that you all have established in your communities. So really making sure that we're approaching the narrative, or approaching the discussion on our terms. The goal here is to make it clear that program integrity has always been a core to the work, of course, and accountability and access, of course, are not mutually exclusive. They should go hand in hand. Third, we're continuing to elevate home and community-based services as a smart and cost-effective investment, one that helps people remain in their home and avoids higher cost care down the line. You'll see these themes reflected consistently across all of the materials. So with that foundation, let's walk through the tools that are available to you. First is the messaging guidance itself. I won't walk through it line by line, but do know that it is your go-to resource for how to frame issues in state level discussions. It reflects the messages I just mentioned. It's something that you can quickly reference as you're engaging with media, stakeholders, and policymakers. It's designed to make it easier to stay consistent and while also tailoring the content to your state context. We've designed the tools, again, worth repeating numerous times, to make it as easy as possible for you all to engage with others, whether it's media, it's stakeholders, or your broader community. Everything is meant to be practical, adaptable, and ready to use so that nobody is starting from scratch. I'll walk through each. First is the template press release. This is announcing your participation in the national campaign of Here We Stand. It's a strong way to publicly reaffirm your organization's stance and engagement on Medicaid advocacy. It's designed to be very plug and play, as you can see. You can add your organization's name, tailor a few details, and it's ready to send to media or post on your website. It's already formatted in the way that reporters expect, which helps encourage press interest and also follow-up. It's especially useful if you're looking for a way into the news cycle. So for example, you can share it with your media list around a state hearing, a budget milestone, or other key developments. So again, quick to adapt and really ready to go. We've also developed social media guidance and ready-to-use content for you all, including sample copy and graphics for Facebook, LinkedIn, and X. What you're seeing here is an example of how these pieces can come together in practice. Everything is designed to be used as is or lightly customized depending on your needs. For teams looking for a lower lift way to stay engaged and visible on the issues, this is a really strong option. At minimum, it's additional really high quality content your teams can easily plug into their channels. So you'll notice too that the messaging reinforces those same core themes, the impact on families, access to care, and practical ongoing approaches to really continue to strengthen Medicaid integrity. These tools are meant to be flexible, so please use them in a way that works best for your organization. As Karen had noted, for those interested in a higher level of engagement, we've included an updated op-ed guidance. The document, which all of these resources can be found on the website, will walk you through the process step by step of how to develop your opinion piece, from shaping your angle to submitting to outlets. It includes examples of op-eds that have broken through, including one from the first phase of the Here We Stand campaign in the Portland Business Journal. And it also includes practical insight into what editors are typically looking for in these drafts. The goal here is to make what can feel like a heavy lift really much more manageable for you all. So if you've been considering an op-ed but haven't done one before, this is a really great place to start. Also available to you are letters to the editor, or LTE templates and guidance. These are a quick way to respond to news coverage or ongoing developments. They're much, much shorter than op-eds. They're designed to be easily customized, submitted quickly with a structure that really helps increase the likelihood of publication. It's one of the fastest ways folks can engage publicly, especially when something comes up in your state. So, for example, if you see coverage on Medicaid work requirements or even state budget negotiations, you can use these templates, tailor them to your perspective, and then send them directly to the outlet. So again, it's another quick, effective way to share your stance, where your organization stands on Medicaid. Finally, we've developed a set of frequently asked questions and responses to help prepare you all for tougher, more detailed questions. It's really meant as a support tool, whether you're speaking with media partners or even need help kind of like internally aligning on what to say on certain issues. It includes clear, concise responses to things like HR1 impacts, again, fraud, waste, and abuse, issues, work requirements, and even provider taxes. The goal is really to help you answer confidently and consistently without having to draft something in the moment. So it's there whenever you need a quick, reliable reference. All of these resources, again, are available on the Here We Stand website. The link will be shared. You see the URL at the top there. And so we just encourage you to take a few minutes to explore what's the most relevant for your organization. And the intent, again, is to make it as easy for you all to engage in a way that fits your time and comfort level. Obviously, opposition messaging has been really disciplined and sadly been very effective in some ways on this topic. So it'll be really important for state leaders and national leaders to hear from everybody and really singing from the same song sheet on this. And these tools are really here to help you do just that. So with that, I'll turn it back over to Bill.
All right. Welcome. Welcome. Thank you, Kat. That was tremendous. Those tools were great. I think they're really, we started using them last week on the Hill, on both the messaging and then the FAQ were really tremendous. I think that we've already gotten some feedback from marketing teams who've got a quick glance at them and being able to, as you said, plug and play or, shovel ready for people to use. I want to point out that all those resources, again, are on our website. They're available to you. We'll send them out in links so you're able to use them. But we will be offering, going forward, office hours, technical assistance. We'll be posting that and sending that out to the membership so that they can use that time to feel comfortable with the tools. And I know for some people, when we looked at the readiness survey, some people are ready to go and ready to move forward with it. And some people, I know that as I'm thinking about those, just want to make sure that I'm using the same context. And we will finish this at the end of our conversation about agencies that have already been able to use some of the tools previously or in the future. So thank you, Kat. So now we're going to do a little question and answer. If you have a question, please raise your hand and I can call upon you or come off mute and we'll make sure that you can ask Kat and Karen any questions about the work they've presented and some of the tools that they've been able to present. So.
This is Sarah, and I'm going to ask, this is a question that I think we heard come up last week when we were together with our some of our membership who was here for the Hill Day, is what if an organization or an individual within the organization really has no experience with this kind of engagement? I know you've set these things up so that there's some easy on-ramps, but if somebody has really had no prior experience, what would you suggest as a very first entry point? That can be for either of you, but
I'll leave the all of the expertise around messaging to Kat, but as a lifelong advocate, start from your home base. You know what you know. If you don't feel confident being a Medicaid expert, spoiler alert, nobody does, except for the people in your Medicaid program, but you know the communities you serve. You know how social services and healthcare intersect. You know the pressures. You know how artificial and perceived barriers, as well as real barriers, impact their lives. I would start telling stories about what you know and bring in people that are the face of the story. And from there, I think it will feel pretty natural to give a real life impact. And you do not need to be a policy expert. You need to be an expert in the communities you serve.
Yeah, absolutely, Karen. And it's really those real life impact stories and what folks are seeing on the ground that are going to carry a lot of weight to your audiences. These tools that we've created, both Karen and I, as well as the entire LSA team, are here to just help you feel more confident in that. But it really is that part of the story or the conversation that folks are really, really looking for, especially media, those human interest, human impact stories.
Right. Thank you, Karen. You know, one thing that I often think about is like the FAQ and a lot of the information you provided, Karen, give us the facts to kind of have a deeper knowledge, you know, that 201 or a master's class in Medicaid. But like you're right, nobody's an expert on it. And I think the stories are at the end of the day that what resonate. But if you're pressed in that meeting, then you can lean back on the FAQ to kind of have an idea of where that origin came from. So great. Any other questions?
I have one quick question. So here in Alaska, we are very active members of the Alaska Behavioral Health Association, which also does a lot of advocacy. Is it okay to share these resources with state associations? What are the rules around that?
Yes, please share them out. I'm seeing Susie.
Okay.
But yeah, thank you for doing that.
On the
Thank you.
national level, we're sharing with other partners that are in the same space. And then we're actually, I would say to Kat and Karen both, some of them are kind of ever changing, you know, meaning that sometimes we get some additional information even this morning and they somehow integrate it into the conversation. So thank you. Yep, great question.
Thank you.
One of the things that Sue often says, our Vice President for Government Relations, she says, you know, the thing that's most durable is our partnerships. So those associations are the things that carry us all forward. So great point.
And I would add, not only is it the genuine fabric of how you all work, it also, for the receiving end, it is less of a cognitive load. If they hear similar things from similar types of organizations, or they hear it from you in unison, if you act as a coalition, then that is less effort for your intended audience to absorb that, especially if you're doing something like a briefing, a sit down, or a site visit or something like that. So it all makes very good sense.
We
I
have
like,
just a few more. Go ahead.
oh, I was going to say, I like the synergy behind it, not reinventing the wheel. So thank you for providing the resources.
Here's a great question from the chat. John Moeller from Georgia asked, here in the Southwest, how should messaging be tweaked to our legislative leaders here? Because none of our states were expansion states.
So that's no surprise to anybody in your state, and you will not be an expansion state anytime soon. So you do not have to get involved in weeds that are not helpful weeds for you, is what I'd say. You've got your own garden, and I'm sure there are other weeds you need to tend to. So maybe you instead, John, would be talking about the general financial footing in the state of Georgia. The good Stuart Portman is an excellent leader. He comes with great inside the beltway credentials. And the rest of the team is very used to hard times. Sadly, we were only flush because of the federal investment as we recovered from COVID. So when you just talk about how a state makes difficult choices and how we see cost-cutting measures show up as expenses in other places, that's probably a message that folks can get behind because they do want to contain costs and not see uncovered expenses show up in emergency departments and other places like that. So I would say that you don't have to speak about the expansion because your state won't be speaking about it either.
Great. Well, thank you, Karen, and thank you, Kat. That was tremendous, and really appreciate all of these tools. And we are here to help. Both the LSA Government Relations team and Kat and Karen are here to help us make sure that we carry this message forward. We do know that the conversation right now has really moved to the states, and all of these tools are hopefully are there to prepare you and able to answer that question that we asked in the beginning: is are these tools usable for you to engage with your state legislators? So thank you. We are going to switch to our next speaker, who is Jonathan. Welcome, Jonathan. And I'm going to have, I hope Jonathan starts out and tells a little bit about an effort that he led last summer. He invited us to join him. And we had members of our disability network, but also our larger network join us from Pennsylvania, I know for sure, Ohio, and some other states. And thank you for joining us today, Jonathan, talking to us a little more about work requirements.
Of course, thank you so much, Bill, and thank you to Kat and Karen for those really fantastic presentations. I think what I'm going to talk about really will build on that, zoom in a little bit on the work requirements implementation process that's underway in states across the country, and also just want to share appreciation for Sue, Bill, Sarah, and Kylie and the LSA team, who are just wonderful partners, I'm sure, for all of you, and also for us here at the Network of Jewish Human Service Agencies. So Bill alluded to last summer in June, we collaborated, Lutheran Services, the network, and Catholic Charities, and a couple of other interfaith partners worked together to bring a final last kind of ditch effort. DC Fly-In brought about 50 people, about 30 people to Washington, D.C., met with over 50 offices to explain the impact that the SNAP and Medicaid changes through H.R. 1 would have on our communities. And it was just wonderful to partner with you on that and to continue that partnership moving forward. So thank you very much. I'm sure many of you in cities and states across the country are aware of our member agencies in your communities, oftentimes going by names like JFS, Jewish Family Service, or Jewish Family and Children's Service, or some variation thereof. Really excited to connect between you in the future, make sure that we're collaborating as well at the state and local levels moving forward. So sharing some of this Medicaid work requirement update, this is just a refresher, this first page of what was actually implemented or passed in H.R. 1 or OBBBA. It instituted for the first time ever work requirements for the Medicaid program to be enforced by states by December 31st, 2026. So we have about 8 more months for states to start moving forward in this process. It applies to Medicaid expansion beneficiaries in expansion states. That's about a package of 21 million people. As Karen mentioned in her presentation, this is where we expect to see the most folks drop off of the Medicaid program because of the challenges with the new Medicaid work requirements as they get implemented at the state level. There's a limit, or there's a threshold of 80 hours per month on average of meeting these work requirements that can constitute work, community service, or a work program of sorts. Some states are looking to start earlier. Others are looking to kind of delay and hope to apply for a good faith waiver extension for 2 years to have a little more time to implement these changes. I'll give you some examples from what we're seeing across the country of how even though these changes were handed down from the federal level in H.R. 1, there is a lot of latitude for states in the implementation process that will have a significant impact on your clients and on your agencies moving forward. And so really encourage you to include this in your advocacy at the state and local levels to push for more of these flexibilities that we'll touch on here. This bill also, HR 1, also included more frequent eligibility checks, moving from twice a year or from once a year to at least twice a year, with some flexibility, again, latitude for the states to do that more often. We'll see what some states are talking about here. The initial government guidance about these changes came out in December 2025 from CMS. It was very illuminating and helped states start moving forward in this process, but we are waiting for final guidance from CMS. That's expected in June of 2026. And so, again, your states are having these conversations, especially in these expansion states, which you see here in blue. They're having these conversations, and there's a lot of flexibility. So just to highlight some of these flexibilities, there are some mandatory pieces, mandatory exclusions for who's not subject to these work requirements. That includes parents or caregivers of children 13 or younger, or an individual with disabilities, individuals participating actively in drug treatment programs, meeting SNAP or TANF work requirements. There's a lot of overlap with those. Veterans with a total disability rating, former foster youth, pregnant and postpartum individuals, and a couple of other categories and population groups. There are some optional exclusions. This is where states have some latitude in who they can exclude from being subject to these work requirements. They can exempt individuals under the age of 19, Medicare beneficiaries, recently incarcerated individuals, those experiencing short-term hardship. There is some flexibilities there. Really, where the most flexibility comes in is in determining some of these different implementation pieces. There's defining short-term hardship. What counts as a short-term hardship? Is it hospitalization, disaster declaration in your state or area, high unemployment in your community? There's also eligibility check timelines. So I mentioned that now states will have to check at least twice a year. States could check as often as they want. And we're already seeing some states start talking about implementing that. There's also a flexibility in the months that a beneficiary needs to meet the requirements between renewals, and also in the months leading up to being eligible an application, whether it's 1 month, 2 months, or 3 months. Obviously, a big change between those three. There's also, as I mentioned, some states that are moving to implement this earlier, ahead of the December 31st deadline, others that are hoping to target that good faith implementation extension for 2 years by a little bit more time. So I want to use a case example just to really highlight how different this program could look and how different implementation could look in states across the country. So I know we have someone on the call from Indiana. This is likely not news to you, but there's Senate Bill number 1 in Indiana. They're really looking to move quickly on implementing these work requirements for Medicaid, implement them early. This bill is an example of moving to the kind of most stringent levels of what the guidance or what's allowed through HR 1, and with the least flexibility as possible. It does not count education towards those 80 hours required for compliance to meet those work requirements. It requires 3 months of Medicaid pre-enrollment compliance before a person is eligible, rather than 1 or 2 months that could be options for states. It mandates monthly compliance checks for Medicaid recipients. So we said that states need to check at least twice a year. Indiana's bill would propose monthly checks, which is a huge bureaucratic challenge for not only your clients, but also your agencies, in supporting your clients through those processes. It also prohibits short-term hardship exemptions that could be allowed under the federal law. It eliminates a state option to expanded broad-based categorical eligibility, which is used in 46 states to really lower that churn that Karen was talking about earlier. And it also requires medical certification for someone to be determined medically frail. So this is, again, an example of one state that's kind of moving to the most stringent allowed spaces on implementation. If we were to talk about the other side of this spectrum, if we were to talk about a state that's fully embracing every flexibility that they could from the HR 1, they would perhaps request an implementation extension, buy a little bit more time to educate their clients or the constituents about these changes, and make sure that they get the system down. Karen mentioned that there's not much of a successful existing example of implementation here, and so states are really going to struggle with implementation and with maintaining this program moving forward. There's also, they could require just 1 month of Medicaid pre-enrollment compliance before eligibility. They could mandate biannual compliance checks rather than monthly, and they could coordinate those compliance checks with the compliance checks for TANF and SNAP so that they're not happening separately and confusing everyone with different processes. And then they could also adjust the way that they accept or check the community engagement hours rather than a weekly timesheet. There are some states, I know our colleagues in Massachusetts are having conversations about kind of just sending a letter from where they're employed, where they're volunteering, where they're studying to set the foundation that they are meeting these requirements. It's not something that the client would need to do every week. So just very quickly, this is coming to your state. Your state is having these conversations. Really encourage you to participate in these conversations. Your perspectives as provider agencies working hands-on with these clients, the folks who are going to be impacted, is invaluable in these conversations for legislators. So really encourage you to have those conversations and make sure, where possible, to add some flexibilities to accommodate your clients. Make sure that we're adjusting this program in a way that works for your clients, works for the program. So thank you again for the opportunity to share here. I'll make sure that these slides are shared out in follow-up and appreciate your collaboration at LSA.
Thank you, Jonathan. Really wonderful presentation. Again, as you echoed, we really thank you for your partnership. You're an organization and your team have been tremendous for us. And what we wanted to do is, work requirements being one of the first provisions of HR 1. We wanted to give a little technical assistance there, but we will share Jonathan's slides, and then we'll also be able to access, if you guys have questions based off the presentation, we can follow up with him on that as well. So thank you again. And now we're going to turn to a panel, and we are really kind of packing everything in here today because we feel like it's important to prepare and get ourselves ready for advocacy. So I'm going to be welcoming Aaron Sutton from Minnesota and Aurora Kerpa from Pennsylvania. And I'm going to walk them through some questions just as a panel, just to kind of get us thinking about how our members, our Lutheran Services America members, are putting advocacy to work. And so kind of a general question to both of you is, what initiatives are you currently leading or a part of in your Medicaid advocacy efforts that are happening at your state? And I'm going to start with Aaron real quick.
Yeah, thanks. Hi, everyone. Again, I'm Erin from Lutheran Social Service of Minnesota. One of the examples I wanted to uplift, which touches on some recommendations from earlier in the webinar, is related to working in coalition. So in Minnesota, we have a really robust statewide coalition. We're called This is Medicaid. And some things that we've been busy doing over the last 6 to 8 months is we created a resource around like an HR1 timeline, rolling kind of the timeline for implementation so that we could utilize that in our conversations with our congressional delegation, but also the state legislature. We've also organized nonpartisan and very education-focused roundtables with our state legislators at the beginning of our state session so that they knew what our asks were, especially as it related to the most timely provisions like work reporting requirements. And then we also did a series of press conferences that focused on the impact of Medicaid and was very stories focused as well. And then we would do different press conferences on different themes based on populations supported by Medicaid. So this really, I just have to say, supports what's been stated earlier, is that it was a way for us to all be organized and say our message in unison. So legislators and decision makers were hearing the same simple message from all of us across the whole Medicaid stakeholder spectrum. And also it's a way to really access the expertise. So I'm not an expert on work reporting requirements. A lot of the folks we support won't be impacted by that, but we know what the impact will be in terms of, the fiscal pressures our states are going to be under after having to invest more on rolling those out. It could lead to, say, cuts in home and community-based services. So we're able to say a message in unison and then everybody play their part in the really diverse Medicaid constituency so that we can all play to our strengths and really conserve resources and be really impactful.
Thank you, Aaron. And now I'm going to turn to Aurora, ask her the same thing. But what I would encourage everybody who's on here, if you're following our members online follow KenCrest. They're kind of leading the way and inviting legislators to spend some time with them. So I'm going to have Aurora talk a little bit about some of their initiatives. Thank you, Aurora, for joining us.
Sure. Thanks, Bill. Well, after listening to Karen and Kat and Jonathan, I made a lot of notes and sent a lot of chats to people because I feel like we're not doing enough and there's so much more we can do. So I really appreciate those resources. And so we do a lot of site visits. So we invite legislators to come out all the time to visit with us, and those are pretty successful. I think that the hearing from people and seeing the people we serve is much more impactful than anything that I can tell them in their office. So I do prefer them to come out. We had a listening session in Pennsylvania, and we invited our 3 provider organizations were there. And so we worked with PAR, our CPA, Max. We also work with Anchor and obviously Lutheran Services. In the listening session, we had DSPs and we had people we support who went around and told their stories and their stories, their personal stories and how they related to KenCrest. And I would say that, those are pretty important moments. I think that our efforts are there, but I'm not seeing the outcomes yet. So I think that's what's making me a little less hopeful. So, we're just waiting to see. So another thing that we did was we had a self-advocate day. So we had Tia Nellis and Nancy Ward. They're self-advocates who go around the country, and they did a training for our individuals. So we had a self-advocate toolkit and workshops and teaching people how to speak up for themselves and how to advocate for the services that they need. So I think the focus has really been in pushing self-advocacy and having legislators hear from the people that this impacts directly. And I think really considering the op-ed and some of the resources that you guys shared for the future. So I think definitely there's room to do more.
Thank you, Aurora. Thank you for leading that challenge on lived voices, right? I mean, I think that it's such an important person. I know one thing that's often used is it's hard to hate up close. It's hard to make these cuts and make these decisions on based of people if they really know the level of support and services they're receiving. So thank you. So this is a broader question about challenges, and maybe be brief on this one because I want to spend a little time on the last one, but not that you're not brief on the other. But Karen, what was the biggest challenge you've had, and how did you overcome that? I know it's probably a bigger question.
Yeah, that's a big question. Well, I'll go back to what we heard earlier around, there's fiscal constraints that our states are facing, a really big focus on fraud, waste, and abuse that doesn't tell the whole story of the hard work that our organizations do to uplift program integrity and what that looks like in practice. So what we've done is really taken that step to reframe and share a message that talks about what we do and our long history in doing that. So we have 3 one-pagers that we've created. One that is focused on our trustworthiness, how we show up through strong governance, financial oversight, and compliance. High quality is the second one, and that's very consistent on how we do our measurement, evaluation, and improvement. And then the third one is around our innovation and how that is evidence-driven and really tests and strengthens our services before we grow them. And that has been a really great way. We've used that with our state and now our congressional offices when I was on the Hill last week with LSA. And members really, really appreciate that because they know and have a lot of trust in the work that we and our partner organizations do, but that really gives them a tool to, again, speak with evidence about how Medicaid providers have a long history in program integrity.
Thank you, Erin. And Roar, how are you guys addressing challenges that you're seeing?
Well, workforce is a challenge for all of us, I think. And so what Pennsylvania is doing with performance-based contracting, there are so many metrics that now we have to meet. Fortunately, from what I hear from talking to other providers, I think we were pretty prepared. So we didn't have to do a lot, but what we Erin mentioned quality, so we did get accredited. We are having our DSPs go through NADSP certifications, also our frontline supervisors, to kind of show that we're doing self audits. This is a high quality organization. But the other thing that someone said to me was, stop acting like a small player. You employ 1,800 people. You're taking, like, you have to show people. I don't think the people know how big this is. So it's not just about the people that you're serving, but it's also about the economic impact and how many people you're employing. So, and it seems to me from conversations that I have, especially with our early learning centers and the advocacy that we're doing there is workforce is a topic that legislators really like to talk about. So we're putting workforce in there. We're saying this is, we employ 1,800 people, and we have vacancies. It would be 2,000, but so using that in our argument.
Thank you. Kind of taking the challenges that are out there and turning that into the conversation of solutions. That's really powerful. So kind of really quick, what's next in your your advocacy efforts, and maybe a second about how you might incorporate some of the tools or maybe that you have used.
Yeah, I'll go quickly. I'm really excited to dive deep. I've opened and bookmarked all the resources that were shared today, and how that can add to our individual resources, but I'm really excited to bring it to our state coalition. And I know folks asked about that earlier, of how can, again, for the piece of the Medicaid pie that we can help uplift and tell that story. Really excited to bring that to our external advocacy work.
Great. And how about you, Aurora?
Well, the reason why I was so excited about these resources, because I think they really simplify the messaging and explain what Medicaid is, because it can be so confusing. So I'm going to use them for board education as well. And I think they're going to be very helpful, and maybe and they will understand what we are talking about. But I also appreciate that we can share these with our state provider organizations. So I do plan on reaching out to them, and then we have an internal advocacy group. So I do plan on sharing with that group and our employees. So I think just oversharing.
Thank you, Aurora. That's great. I thank you guys both for both of that. And before we move on to the final question, I just want to make a point that last spring, when we had our first Here We Stand campaign, we really we had a lot of members pick up the tools that we were using. They did op-eds, they did some podcasts and used the information that we were able to provide. They actually matched their tools. They took their marketing tools and embedded their colors into the schemes that we had, which we wanted to be pliable. But if you leave today's webinar with the idea of I'm not sure how to turn the key to this, as I think that was Sarah's question, is how do we lift this forward? Contact anybody on our government relations team, because we spent a lot of time working on the tools, but it's been in collaboration with our policy committees and with our members to make sure that they're usable. But I think that they should be shovel ready, but we also know it's easy. But I'd be sharing them with your leadership teams, sharing them with your marketing teams, and all of that. So the goal of today's was to prepare you to use our Here Our Stand messaging tool. So we're going to put the survey out there, and then we will thank you for your time. So. Well, great. We do have 5 people that are fully prepared. We have a lot of people, 10 people that are well prepared, and then some that are moderately prepared. And we recognize that everybody's on a different continuum of how they're going to be able to use the tools and integrate them. Please use us as a resource. We feel like this is a really important time. It's a really important message, and there's no question that that we shouldn't be able to try to work with you to address, because at the end of the day, it's important that you're using them. Just want to remind people, please join us in May 21st for our next Capital Conversation series. Also, in our community advocacy leads group, we would like to have you join us there. You'll get emails from that group, but also all the resources that are there. And then we will be providing a follow-up email that contains all the material from the webinar and the slides. Thank you so much for joining us today, and have a great day.
Thanks, Bill.
You're welcome.